I'm afraid that someone from the city is going to get really mad if I get closer to this than the microphone.
We'll have to check.
But can you hear me?
Let's see. You
Um,
talk like the mayor of the city of Knoxville.
I can do my best to talk like the mayor of the city of Knoxville. How about this line of people right here trying to get their tax renewed or whatever it is they're doing?
know.
I asked him, I said, you know, you can do that online.
Okay.
I said, no, I've got something else to do. I couldn't understand what
Yeah.
he was saying. But I said, you can do it online.
Yeah, that seems like a lot.
Yeah.
Is this okay? Can you all hear me? I'm Indya Kincannon, Mayor of the City of Knoxville. We're doing all we can to stop the spread of COVID-19. I'm here with Bruce Spangler, head of VMC, Chief Thomas, Chief Sharp, Stephanie Welch, our head of Economic and Community Development, who's also been helping coordinate our work towards serving the homeless during this crisis. You guys ready? Everybody? Okay. Good afternoon. I'm Indya Kincannon, Mayor of the City of Knoxville. I just introduced the people who are standing here beside me. We're here to share information and answer questions about two things that we've recently done. One is the executive order I signed yesterday to enforce the Knox County Health Department's Safer at Home order, which was issued last week. I did that executive order. It's a verbatim exact words of the health department's order, and I did that so the people who work for the city of Knoxville will be authorized to help the health department enforce it. And the reason we chose to do this at this time is because the number of COVID-19 cases is going up every day. It's more than doubled just in the last 3 or 4 days. I think we're up to 77 confirmed cases in Knox County, and we've had one death attributed to COVID-19. And we have seen a lot of people complying with the Safer at Home order, but there's a lot of people who are not yet taking it fully seriously. So I passed this executive order to empower the City of Knoxville codes enforcement, fire department, police department, parks and rec employees to help enforce this order. And when I talk about enforcement, this is not about punitive measures. The first and foremost thing is to inform people what the Safer at Home order is and what the expectations from the health department are and why we're doing it. And we're doing it to save lives. The only known measure to stop the spread of COVID-19 is to have a physical distance between you and other people. So that's why even everybody here is standing beside me in a metaphoric sense. We're spread out because we practice what we preach, and we're trying to maintain at least 6 feet of social distance between everybody. The other reason we're here is we did a media release earlier today. One of the big challenges in our community is people experiencing homelessness. How can they follow? They cannot follow the Safer at Home order if you do not have a home. So a lot of people in the community have been asking, what's the city doing to help? And let me tell you, this has been a big concern for all of us. And everybody has been working really hard and in coordination with social service organizations like the Volunteer Ministry Center and the county and the health department. And today we are proud to announce that we are working with the Metro Drug Coalition, the Volunteer Ministry Center, and several other entities to open a shelter at the West 5th Avenue. It's a facility that's owned by the Metro Drug Coalition, and it's going to be a place where homeless individuals who've been tested for coronavirus and who suspect that they may have it. We have no confirmed cases as of yet, but there's a place for up to 18 people to be quarantined there in a safe, sheltered environment. It's going to be managed. Big thanks to Bruce Spangler and the Volunteer Ministry Center. We're going to provide 24-hour management of the shelter. Many other community partners have offered to help with other needs of this group, including food and showers, and the Red Cross and the Baptist Association and CARM and others have stepped up to help. And most importantly, and the hardest part, most complex element to this is the medical care needed. Because our neighbors who are homeless, some of them may have COVID-19. Again, no confirmed cases as of yet. But even before they may experience COVID-19, they have other illnesses that they may be experiencing, mental health issues, physical health issues, addiction issues, and these require medical supervision. And the health department has found a medical provider to help provide that kind of care as needed. And we really appreciate all the partners working together to do this. I appreciate all the city leaders here today who are helping with enforcement. And again, this is just to enforce what the Knox County Health Department put in place a week ago. And we think that the vast majority of the people, when they know the serious nature of this, we'll be more than willing to cooperate. We just need to raise attention and shine the light on this is a serious, serious matter, and that's why we're doing things like encouraging people to be outside, but not in large groups, encouraging people to take walks, but not to congregate in groups of 10 or more, and to maintain that physical distance of 6 feet or more. I'll be happy to take some questions.
I have a question. This is, when you talk to the other mayors in the state, can you give just a little synopsis of what you guys talked about with the different mayors across the state?
Yes, I've had the opportunity. He asked if I'd had what I've been talking about with other mayors across the state, and I've had the opportunity to have group discussions with mayors from across East Tennessee, a group of 16 counties. We've had several discussions and about what they're facing and challenges with personal protective equipment and testing and just uncertainty and that sort of thing, and what we're doing to address those things. I've also worked pretty closely with the mayors of the 4 big cities, Chattanooga, Memphis, Nashville, and Knoxville, because of our larger size and higher density, and we have more large hospitals. We have some things in common with how we're addressing these and the need for coordination, and with our hospital community in particular. But yeah, so we've had those conversations, and also working closely with the governor and his organization that I can't think of, what's the name of the organization that has like a military term that he, well,
Army Corps of Engineers?
well, the Army Corps of Engineers, but he has like a unified command. The unified command entity that the governor has put together is now helping coordinate things statewide, particularly in regards to personal protective equipment, which is a huge need in our community, and as something as mayor, I'm very concerned about making sure our employees, our police, our fire, our public service workers who are out there attending to emergencies, answering calls, have the protective gear to stay safe and healthy, because these are essential workers and we need them to stay healthy to keep the city running. So those are the kinds of conversations we're having. This is a public health emergency, and some of the tools we need to focus on are communication, collaboration, and just staying connected and working together, and again, assuring people that we're working, but also asking for help as needed across the state.
Mayor, can you talk to some of the enforcement? I know you said that you're hoping, and the hope is most people are abiding by these rules, but there are businesses that are not. And you even mentioned this weekend some of the people jumping fences and playing basketball and stuff like that when they should have been. Can you talk about some of the specific things the city can do, whether it's maybe it's cutting off electricity, maybe it's padlocking doors, maybe it's none of those things? Can you just talk about what those look like?
Well, we have a lot of authority to do things on city property and on public property. On private property, we will rely more on the cooperation of the business owners and just the community itself. I feel confident that people will cooperate once they understand the serious nature of this. We do have the ability to issue citations of $50 per violation, and that would also include court costs. But that's certainly not our goal. Our goal is to get people to comply with the public health order that Dr. Buchanan and her team of people think is a necessity, and I support that order, and that's why we're partnering with them to work on enforcement together.
And then if you could talk about, other than, I know you said city parks and stuff, what other issues are you seeing that alerted you that maybe even...
Well, I think this weekend, a lot of people have been home, idle and have a little cabin fever. So a lot of people were out and about, which is a good thing. But some people were, somehow we had closed down some tennis courts and that sort of thing. And apparently there were reports that people had somehow broken through those closures to access the courts, even though there were signs and other things encouraging them not to. And again, I haven't seen these things firsthand, but we have reports through 311 of people gathering in large crowds. Again, the public health order, the Safer at Home order, you're allowed to go to restaurants and take out and carry out food and support our local businesses, but you're not allowed to be inside and dine inside. You're allowed to go patronize a food truck, but you can't have a food truck party with like 100 people hanging out. So these are the kinds of things that I think our enforcement will just help educate and inform. And everybody, practicing social distancing is an act of solidarity and compassion for the many of us who have friends and relatives who may be at higher risk. Right now in the state of Tennessee, the number one age group that is being diagnosed with COVID-19 is the people in their 20s, who I think feel like they may be at low risk or that they can get it and survive it, and they may be right, although there's serious cases at all ages. But what they don't always realize is that you might be a carrier and give it to someone else who might experience a more acute case and even a fatal case. So that's what we're trying to inform people and educate people about, that the risk is to everybody, and if everyone's responsible, that's the best way to stop it. There's a lot of evidence that the practicing the physical distance and having some enforcement is working in other cities, and we want to limit the death and morbidity that may happen as a result of this virus.
And as I understood the release, the KPD won't be doing those checks. It would be KFD and city codes.
Yeah.
Can you just
Chief Thomas, would you like to speak to that?
have your hand up?
So the question was enforcement?
Yeah, whether that's your office, if it's stands, or how that's
Right.
going to be taken.
Right now, the fire department and codes enforcement will be responding, and they will be addressing those issues. But I want to reinforce what the mayor said about education. That's our goal, is to educate the businesses who are remaining open, and maybe they're not aware of the potential liability that they're causing by remaining open. So that's our first stress, is education, and educate these folks about why it's dangerous to stay open. The enforcement is the last resort. We don't want to resort to that.
Have you received any calls yet since that order's gone in effect? Have you received any calls?
We have not. Have they routed any to you? No. So, but if people are out there and they see these things, we want them to call 311 and do report those, because we do need to educate people who are either not aware of the order or aware that it applies to them, or they're actively violating it.
I just want to make an announcement about something we're doing in support of our first responders. We're going to be lighting the pedestrian bridge over Henley Street in red, white, and blue, just to honor and support the many people in this community who are essential and who are responding to this on the front lines, including our police and fire department personnel. And this is just one way we as a community can support them and highlight their efforts and sacrifice. And that goes for our EMTs and also our hospital and healthcare workers as well. So I think that's a gesture that will just remind people that this is a serious thing, and that we want to protect our first responders and honor them for their sacrifice every day, but especially during the time of this pandemic. Does anybody have any questions about our efforts to serve the homeless in this instance? I have Stephanie Welch here, who's been leading some of the coordination efforts on that regard, and also Bruce Spangler here from Volunteer Ministry Center, if someone has more detailed questions about that.
I guess the only question I have is, how will the city be aware of when someone feels like they're affected? Are they, what
You mean someone in the homeless community?
Correct, yeah, so at what point do they decide, oh, I think I'm sick, where do I even go? I don't have a personal provider. Like, how does that work so the city can even get alerted to it?
Sure. So there are already protocols. So the question is about how do people get referred to the shelter, or how do they end up being placed at the shelter, which is really intended to serve both persons who are homeless who have been tested but not yet confirmed positive. We don't have any positive cases yet, but we sure do want people who've been tested but not confirmed to be able to be in an isolated, safe spot. So that is the purpose of this shelter. Those referrals will come from the health department and from healthcare providers. So if someone is tested at a hospital or a health clinic or by the health department, they'll be referred into the shelter and served at that point and spend their 14 days in quarantine while they're waiting test results.
Mayor, actually, I did have one other question. Dr. Buchanan mentioned this afternoon that Kroger was going to be opening up a drive-through testing space at one of their stores. I don't know which one it was. Separate to that, we told that Knoxville is looking at doing something similar. Can you talk to any plans that the zoo might have to be able to do some drive-through testing?
All I know is that there are some plans. I don't know what the status of them is. Being able to have, quick tests that are, done as expeditiously as possible. Sorry, I'm a little cold. Efficient and accurate is really important, and I believe that is in the works. But it'll have to be. It's still, even though it's a drive-through arrangement, I think it's still by appointment only, and people have to be eligible. We don't have enough tests to test everybody who might like to be tested. So until those more tests become available, we're relying on the health department to be able to prioritize people and get that done as quickly as possible. It's also certainly a priority for me, and this is something I talked about with the other mayors and the governor, to have tests available for our first responders, because their health is paramount. We need to make sure that they stay healthy so they can respond to emergencies throughout the community, everyday emergencies that happen routinely, and also be able to respond to health emergencies for people affected by the pandemic. So we're also working on having some priorities for testing for our first responders.
Mayor, several people have been asking and reaching out to the city as well as the Joint Information Center about the space underneath the I-40 bridge along Broadway.
Oh, yeah.
Day space. I don't know if Stephanie or Bruce or someone could address how that is being handled through all of this.
I'm going to ask Stephanie to address that.
So the question is about the day space that's over on the Broadway area that is a safe space for people who are homeless to be during the day. And so the city has already stepped up all efforts to make sure that that space is being cleaned every day. So we're actually disinfecting the area on a daily basis. The security guards that staff that space have access to hand sanitizer and disinfecting wipes, and the trash collection procedures have been changed to make sure that trash is being removed quickly and safely. Of course, there are restroom facilities that are adjacent to that space that are being cleaned and monitored, and thanks to VMC for providing assistance with that. We're adding in some additional measures. Tables are being moved further apart within the space to make sure there's appropriate social distancing. We're going to be putting markings down on the ground, mostly just to help provide people with a visual cue. What does 6 feet look like? If you're not accustomed to thinking about 6 feet, I sometimes need a reminder of that. So marking the ground to make sure that people have a visual cue of what that looks like. We are also, let's see, I've got other things here, security guards, markings. We're providing some additional education and outreach in the community just in general to make sure that our homeless neighbors understand the seriousness of the situation and make sure that they have the information they need to make good decisions about social distancing. The other thing we're asking is for community members to realize that by going into communities of homeless persons, you may actually be increasing their risk for contracting this virus. So just being very cautious and respectful that our homeless neighbors have needs that are being met oftentimes by our existing social service providers, working through places like VMC and CARM and Salvation Army, who have protocols and have social workers and have resources that they're offering. And we would really like for folks to work through those agencies so that we're not introducing lots of new people to our homeless community that may actually carry that virus into the community.
Thank you, Mayor. There is one thing I would like to say. Please, people in the public, please follow the guidelines and the restrictions that have been put in place. That not only protects you, it protects others. and it protects our medical personnel and our first responders, and it protects our firefighters. So please follow the guidelines and the restrictions that have been put in place for yourself and for others also.
Thank you very much. I'll take one more question if someone has another question.
This might end up being for Stephanie Bruce, but so these residents who've been going to the gateway will be those who've been tested, the results aren't back yet. If they do test positive, what's the next step?
There's room for people to be quarantined at the same space. I mean, for now, there's up to 18 spaces there for whether you're tested and waiting results, or if you've confirmed, until and if you need hospitalization, and then that's a different level of medical attention required. But if you are confirmed but not requiring hospitalization, there's room for you at this facility. What's the name? What are we calling it?
The guest house?
The guest house. Right, the guest house. But did that answer your question? Is that accurate? Okay. Okay. Thank you very much. Appreciate your time and social distancing, and we'll see you again tomorrow.